Imagine this. You're lying in bed, ready to unwind after a long day, but there's this nagging worry in the back of your mind. Your body isn't responding the way it used to. Maybe you're noticing changes in your stamina, your desire, or even how your body feels during intimacy. For men, that might look like finishing sooner than you'd like. For women, it could be dryness, discomfort, or a sense that your body just isn't keeping up with your heart and mind. And while so many people struggle with these issues, very few feel comfortable saying it out loud. Here's the truth. Over 40% of men over age 35 report concerns with premature ejaculation, and more than half of women after age 40 experience vaginal dryness or changes in arousal. These are not rare problems. They are common, human, and they deserve our attention without shame. You've probably seen quick fix promises online. 1 spoon before sleep and you'll never struggle with early discharge again. It sounds magical, almost too good to be true, and that's because it usually is. But behind these catchy headlines, there's often a grain of truth rooted in nutrition, hormonal health, and pelvic function. My role here isn't to sell you gimmicks. My role is to unpack what's real, what's myth, and what you can actually do to support your body. Tonight, think of this as a private consultation, except you don't have to sit in a clinic or fill out forms. We're going to talk openly about how your hormones, your pelvic floor, and your lifestyle all work together to shape your intimate health. We'll explore the science of arousal, why early discharge happens, what nutrition really can and can't do, and the everyday habits that make a profound difference over time. You are not broken. Your body is not failing you. It may simply be misunderstood. And the more you understand it, the more empowered you become to support it with compassion instead of frustration. So let's dive in together without judgment, just truth. You've probably heard the advice, just think of something else or try to distract yourself. Maybe someone even told you to clench your toes or count backward from 100. These tips are well-meaning, but they miss the bigger picture. Premature ejaculation, or what many simply call early discharge, is not just a psychological problem, it's a real, measurable physiological process. Here's what actually happens. Ejaculation is controlled by a reflex arc, a communication loop between the brain, spinal cord, and pelvic nerves. Think of it like a relay race. The brain receives sensory signals. The spinal cord coordinates them, and the pelvic floor muscles carry out the final movement. When everything is working in sync, you have a sense of control. But if the reflex is overly sensitive because of nerve hypersensitivity, low serotonin levels, or a tight pelvic floor, the relay finishes faster than you'd like. Research shows that serotonin, a neurotransmitter often called the feel-good chemical, also helps delay ejaculation. Men with lower serotonin activity tend to reach climax more quickly. This isn't about weakness or lack of willpower, it's about neurochemistry. And it's why certain medical treatments like low-dose SSRIs are sometimes prescribed for severe cases. Pelvic floor tension also plays a huge role. Imagine the pelvic floor like a trampoline, firm enough to support you, but flexible enough to bounce. When those muscles are too tight, they can act like a spring that's already wound up, firing too quickly when arousal begins. Pelvic floor physical therapy has been shown to improve control by teaching those muscles to contract and relax in a more balanced way. So if you've been blaming yourself or thinking this is just in your head, let's let go of that guilt. This is your body's wiring, not a character flaw. Practical takeaway for tonight, simply start by noticing your pelvic floor. The next time you urinate, try stopping the stream mid-flow for a second, not as an exercise to do regularly, but as a way to identify where those muscles are. This awareness is the first step toward retraining them. Have you ever noticed how your body feels right before climax? Do you feel tension in your pelvic area or lower abdomen? Becoming curious about these sensations without judgment is where progress begins. You've probably seen posts or videos promising that 1 spoonful of honey, ghee, or herbal tonic before bed will completely transform your sex life. And while those claims are often exaggerated, there's a reason these remedies have been passed down for generations. Food really can play a role in sexual stamina and overall hormonal health. Let's start with what we know from nutrition science. Your sexual response is powered by blood flow, nerve conduction, and hormone production, and each of those systems needs nutrients to function well. Zinc, for example, is crucial for testosterone production in men and ovulation health in women. Magnesium helps relax smooth muscles, supporting better blood flow. Omega-3 fatty acids reduce inflammation and support vascular health, which is key for erections and arousal. Now, about that spoonful. In many traditional practices, a small serving of honey, almond paste, or ghee before bed was used to stabilize blood sugar overnight and support hormone balance. Honey provides simple carbohydrates that can keep cortisol, your stress hormone, from spiking while you sleep. Lower nighttime cortisol means better testosterone production and deeper, more restorative sleep, both of which are linked to sexual performance and desire. But here's where we need to be careful. More is not better. Too much sugar can actually worsen hormonal balance over time, leading to insulin resistance and lower testosterone. The key is a small, intentional amount, not a dessert disguised as medicine. If you want to try a 1-spoon ritual tonight, here's a simple science-backed option. 1 teaspoon of raw honey mixed with a pinch of cinnamon or ginger in warm milk or plant milk. Cinnamon can help with blood sugar regulation and ginger supports healthy circulation. This combination may gently stabilize energy levels, reduce stress, and prime your body for better rest, which is when hormone repair and sperm production peak. If this resonates with you, drop a comment. You're not alone in exploring these simple, nourishing habits. And remember, this is just one piece of the puzzle. As you think about this, ask yourself, how consistent is your bedtime routine? Do you eat dinner too late or skip meals and find yourself snacking at midnight? Supporting your body with steady nutrition is one of the most underrated ways to improve intimate health. Think of your pelvic floor as the foundation of your intimate health. Literally, it's a sling of muscles stretching from your pubic bone to your tailbone, holding up your bladder, bowel, and reproductive organs like a hammock. When this foundation is healthy, it's responsive, it contracts when it needs to, and relaxes when it's supposed to. But when it's too tight, too weak, or poorly coordinated, it can create all kinds of problems, from urinary leaks to pelvic pain to early ejaculation. Here's why this matters for stamina. The pelvic floor muscles are directly involved in the ejaculation reflex. They're the muscles that contract rhythmically during orgasm. If they're already tense, imagine a fist that's clenched all day. They're primed to fire quickly, which can shorten the time between arousal and climax. On the other hand, if those muscles are weak or not firing in sync, you might struggle to stay erect or feel like you can't quite hold back. Pelvic floor training isn't just for postpartum women. Men benefit enormously from it too. A landmark study showed that men who learned how to both strengthen and relax their pelvic floor saw major improvements in their ability to delay ejaculation and maintain erections. So, how do you start? The first step is awareness. You already practice finding your pelvic floor by briefly stopping your urine stream. Remember, that was just a test, not an exercise. Now try this when you exhale, gently lift those muscles as if you're trying to stop gas. Hold for 3 seconds, then release fully. Notice if you're holding tension even when you're supposed to be relaxed. The second step is learning to let go. Many people skip this part, but relaxation is just as important as strength. Try lying on your back with your knees bent and breathing deeply into your belly, letting your pelvic floor soften as you inhale. This can reduce baseline tension and help you last longer during intimacy. If you've been silently frustrated with your control, this is a safe and powerful place to start. Your pelvic floor is not just a passive structure, it's trainable. And just like going to the gym, a few minutes a day can produce results within weeks. Hormones are the silent directors of your sexual health. They're not just about fertility or puberty. They orchestrate everything from your mood to your energy levels to how your body responds during intimacy. And when it comes to early ejaculation or changes in sexual stamina, hormones often play a much bigger role than people realize. Let's start with testosterone. In men, healthy testosterone levels are essential for libido, erectile function, and the ability to maintain control during arousal. When testosterone drops, which naturally happens with age, stress, and poor sleep, the nervous system becomes more reactive and climax can occur sooner. For women, testosterone also matters. It contributes to arousal, lubrication, and overall sexual satisfaction. Estrogen is another key player, especially for women in perimenopause and menopause. Estrogen keeps the vaginal tissues thick, elastic, and well lubricated. When levels decline, dryness and discomfort can increase, leading to more tension in the pelvic floor and less pleasure during intimacy. That tension can indirectly affect timing and satisfaction for both partners. Then there's serotonin, the brain chemical we talked about earlier. Higher serotonin activity is linked to delayed ejaculation and a sense of calm. Low serotonin can make the reflex fire faster. This is why some treatments for premature ejaculation actually involve boosting serotonin activity. It's not about numbing sensation, but about giving the brain more time to process arousal before triggering climax. So, how do you naturally support your hormones? The first step is sleep. Testosterone is produced in deep sleep, so even 1 week of poor rest can lower levels. Aim for 7-8 hours of consistent, high-quality sleep. The second step is strength training. Just 2 or 3 sessions a week of resistance exercise can raise testosterone in men and support bone health and estrogen balance in women. Finally, manage stress. High cortisol competes with sex hormones and can blunt desire. If this is connecting with you, subscribe for more clarity on hormones without the jargon, because this is an area where knowledge truly is power. Tonight, just reflect: how is your sleep? How is your stress? Supporting your hormones is one of the most overlooked tools for improving sexual timing and overall intimacy, and it's completely within your reach. Even with healthy nerves, hormones, and pelvic floor muscles, the mind can still override everything. Performance anxiety is one of the most common and least discussed contributors to early ejaculation. This is something I hear often in clinic. It only happens when I'm with a partner. When I'm alone, I'm fine. Here's why that happens. Anxiety activates the sympathetic nervous system, the fight or flight response. Your heart rate speeds up, your muscles tense, and your brain is primed for quick action. In the bedroom, that heightened arousal can make the ejaculatory reflex fire sooner, not later. It's the opposite of what you want, but it's a normal biological reaction to feeling pressure or fear of failure. The good news is that this response can be retrained. One powerful approach is called mindfulness-based sexual training. It teaches you to stay present with physical sensations instead of letting your mind race ahead. Studies show that men who practice mindful breathing and gradual desensitization exercises can double or even triple their time to climax. Start with this simple tool. During intimacy or self-pleasure, focus on your breath. Take slow, deep inhales and exhales, matching your breath to your movements. If you feel yourself nearing climax sooner than you'd like, pause, breathe, and let the urge settle before continuing. This is known as the pause, squeeze, or start-stop technique, and it's been clinically proven to help retrain the reflex over time. Another strategy is reducing shame and self-criticism. The more you beat yourself up about early discharge, the more anxious you become the next time. This creates a loop that's hard to break. Instead, approach it with curiosity. What did I feel in my body just before it happened? Or what helped me feel more relaxed? This mindset shift turns intimacy into a learning experience rather than a test. If this resonates with you, you're not alone. Drop a comment. So many men and women struggle silently with performance anxiety, and simply naming it can be the first step toward healing. Your brain is incredibly adaptable. With patience, practice, and the right techniques, you can rewire it to feel calmer, more connected, and more in control. No gimmicks required. By now, we've talked about the science, the nerves, the hormones, the muscles, and even the brain patterns that shape your sexual timing. But information alone isn't enough. What really changes your experience is consistent, intentional practice. Think of this as your one spoon, one stretch, one breath nightly ritual, a way to nourish your body, reset your nervous system, and train your pelvic floor without turning it into a chore. Start with nourishment, the one spoon. About an hour before bed, choose a small, nutrient-rich snack that supports hormone balance and blood flow. It could be 1 teaspoon of raw honey with a sprinkle of cinnamon or a spoonful of ground flaxseed in warm milk. This isn't about sugar or superstition. It's about giving your body steady fuel so you can get deep, restorative sleep, which is when testosterone and other sex hormones peak. Next, the stretch. Before getting into bed, spend 3 to 5 minutes in a simple pelvic floor relaxation pose, something like happy baby pose or lying on your back with knees bent, gently rocking side to side. Breathe deeply into your lower belly as you do this. The goal is to release unnecessary tension from the pelvic floor, so you start the night in a calm, balanced state. Over time, this also improves your awareness of when those muscles are gripping too tightly. Finally, the breath. Once you're in bed, take a few minutes to practice slow, diaphragmatic breathing. Inhale through your nose for a count of 4. Exhale for a count of 6. This longer exhale activates the parasympathetic nervous system, the rest and digest mode, which lowers cortisol and helps your body reset. This practice not only supports better sleep, but also trains your nervous system to stay calmer in intimate moments. This 3-part routine takes less than 10 minutes, but done consistently, it can change how your body responds over time. You're teaching your brain and muscles that intimacy doesn't have to be rushed, that control is possible, and that pleasure can last longer. Consistency is key here. Don't look for overnight results. Think of it like planting seeds. Within a few weeks, many people notice they feel calmer, more confident, and more connected with their body. So let's take a moment to look back at what we've covered tonight. We started by busting one of the biggest myths, that early ejaculation is just a mental weakness or lack of willpower. You now know it's a reflex involving nerves, muscles, and brain chemistry, and that it can be trained and supported just like any other part of your body. We talked about the power of small intentional nutrition habits, that 1 spoon before sleep isn't magic, but it can be a gentle way to stabilize blood sugar, reduce nighttime stress hormones, and set your body up for deeper hormone-supportive sleep. We explored the pelvic floor, the hammock of muscles that can either help you stay in control or work against you if they're too tight or too weak. You learn that awareness, strength, and relaxation are all key, and that these muscles can be trained just like any other group in the body. We dived into hormones, testosterone, estrogen, and serotonin, and how they shape your energy, desire, and timing. You saw that simple steps like better sleep, strength training, and stress management can have measurable effects on your sexual health. We tackled the mind, performance anxiety, overthinking, and the cycle of shame, and replaced it with mindfulness, breathwork, and curiosity. You now have tools to slow things down, stay present, and retrain the reflex from the inside out. And finally, we brought it all together in a nightly ritual, 1 spoon, 1 stretch, 1 breath, to create a simple, sustainable practice that helps your body feel safe, nourished, and in control. The takeaway is this: you are not broken. Your body is not failing you. It might just need better support, better understanding, and a little bit of daily care. The changes you make today, however small, can transform not just your intimate life, but your confidence, your relationships, and your overall well-being. So tonight, try the ritual. Notice how your body feels before and after. Be patient with yourself. This is a journey, not a race. Stay curious, stay informed, and remember, your body is worthy of care, attention, and respect. If this helped you, like this video, subscribe, and share it with someone who might need to hear this. You deserve truth, not shame, and we're here to give you both.